Overall, I think our biggest worry is that the virus would reach places like these refugee camps. Jordan has already faced a number of COVID infections over the last couple of weeks. We're monitoring very closely the numbers coming through every day. At the moment, we're not seeing an exponential growth by day. We're seeing similar numbers being added every day, but we don't know what will happen and how many cases have been remaining undetected. So the government has taken some very drastic and necessary measures to limit the further spread of the virus. The country has essentially gone on lockdown. Schools are closed, businesses are closed. ACF also has had to close its offices, and our staff are working from home now. And so this is all in a way to try and really limit the spread. For us, we've started measures even before the closeout of the offices in terms of making sure that our staff were meeting the WHO standards for hand washing and provided awareness raising amongst staff on the importance of the hygiene measures to be taken. Now looking forward, we started with phone calls. We have 28 staff working daily on the phone from their houses, calling up a list of 12,000 beneficiaries that we've been working with over the last period to provide awareness raising to communities about the risk of the virus, and that's really in the context of our ongoing water and sanitation programming. And also to provide people with some reassurance, because there's a lot of rumors going around that are often not correct information about the nature of the illness. Overall, I think our biggest worry is that the virus would reach places like these refugee camps, where we'll be distributing hygiene items over the next couple of days, which will include cleaning kits to help people keep their houses clean, disinfectant, and soap and so forth to keep the environment as clean as possible. Then we can start the distributions, which would reach 7,000 households. We really want to avoid any risk of infection in a camp setting. If the lockdown stays for many weeks to come or even months to come, I think our biggest concern is for those vulnerable refugees and vulnerable Jordanians who live really on a sort of day-by-day basis in terms of their income. And so that's one of the things we're starting to think about now is what if this lasts for several months, and how would people be able to sustain themselves while being locked in-house? And is there ways that we can get also cash assistance to people and so forth? But these are things for the longer term, not for the immediate situation we're dealing with right now.